Today, I have summarized what I think will be helpful for beginners who are new to ultrasound. For ultrasound, the low-frequency convex probe and the high-frequency linear probe are most often used. A low-frequency convex probe is mainly used for abdominal examination because it penetrates deep, although the resolution decreases. The high-frequency linear probe is used in organs that do not have to penetrate deeply, such as the thyroid gland or breast. As you can see, in the case of the thyroid gland, if you use the high-frequency linear probe, the inside can be seen well because of the high resolution, whereas if you use the convex probe, the inside cannot be distinguished well. Sometimes, the left and right sides change during the ultrasound examination. These are several ultrasound probes in my hospital. The ultrasound probe marks the left side based on the examiner in various ways. As you can see, these marks are to the left of the examiner when the ultrasound is performed. In most cases, doctors do the examination while facing the patient, so it is to the right of the patient. In most cases, the ultrasound device is in front of the doctor, and the patient is on the right side of the doctor. As you can see, the test is conducted with the probe marked on the left side of the doctor. If you look at this with an ultrasound, the marked area of the ultrasound device faces to the left. Then what you see on the screen is the right side of the patient. In some cases, the procedure is performed in the same direction rather than facing the patient and the doctor. In the case of an RF ablation, depending on the location of the lesion, if the doctor proceeds on the patient's head, the ultrasound will then be taken in the opposite direction from the usual left and right sides. Therefore, you can also guess that the procedure was performed on the patient's head by looking at the ultrasound images. The depth setting is important in the ultrasound device when performing ultrasound. The thickness of the neck varies from person to person, so it is usually recommended that the esophagus and longus colli muscle be included in the back. For this patient, if you set the depth to 2.5 centimeters, it will include all the areas you want to see, and you can see the thyroid gland well. However, if you set the depth to 4 centimeters, you can see the inside of the thyroid gland, but it may be less concentrated because it is not centered. The esophagus and longus colli muscle are in the middle of the screen. Instead, due to the structure behind it, the beginner can diagnose the normal as a lesion. Proper compression is also important when examining. These are different images of the same patient. The lesion is in the left thyroid gland. The left image doesn't show the back of the nodule. However, in the image on the right side, the thyroid nodule is clearly visible. This nodule has a taller shape, but it is not reflected in the image on the left side. You can see from the ultrasound image if the proper compression is applied. The thickness of the SCM muscle in the images on the left and right sides is different. In the image on the right side, which is taken well, the esophagus looks like this. And when pressed, the internal vein is not visible. These are images of the same patient under different pressure. When pressed properly, the thickness of the SCM is reduced. Therefore, the position of the common carotid artery changes as well. In the image on the right, when properly pressed, you can see the longus colli muscle and the C-spine on the back. If you don't press it properly, fake lesions can occur. The thicknesses of the SCM are different in the image above and below, and the image above shows that it was not properly compressed. You can see the hypoechoic lesion in the right thyroid gland. After pressed well, the lesion disappeared. If you look closely, you can see that the shadow was caused by these structures in the area. where the tendon of the strapped muscle meets the SCM muscle in front of the thyroid gland, which has created a fake lesion. If you press it properly, these structures will spread, and the shadow will disappear behind them. Too much pressure is also a problem. In the images, you can see the thyroid micronodule. The ultrasound shows the highly suspicious shape, which is highly at risk of cancer. If you press too much, the nodule will be visible to the back of the thyroid gland. If you adjust the proper pressure, you can see the normal thyroid tissue behind the thyroid nodule. This is an important factor in determining active surveillance. So you can think of it as understanding the nature of the nodule through proper pressure rather than pressing as much. When you use an ultrasound device for the first time, you may be afraid of how to learn and use it well because of too many function keys. Experienced researchers are always interested in new functions and challenge themselves. But in the case of a usual examination, there is no problem with the test by knowing only a few functions well. Residents who are not experienced in ultrasound usually perform the examination without much knowledge. Using an ultrasound device because the machine has been well set by other experienced doctors. Sometimes, when you try to do an ultrasound, the thyroid gland can be seen on the screen in such a strange image. It happens when an assistant accidentally touches the TGC curve while working. The TGC curve can be set by the examiner to suit him or her. Usually, if you put it in an oblique shape like the right side image, the image does not have a big problem. In recent ultrasound devices, TGC curves come out in the form of touching the screen. Some devices do not have TGC curves due to complete automation, so you can refer to them. Next, I will talk about focus and depth control. In my hospital, not only the doctor who uses the ultrasound device but also the assistant who helps the procedure knows the function keys. To make it easier to recognize, it is marked on the device like this picture. This device controls the focus and depth by adjusting the buttons up and down here. This ultrasonic device has a depth adjustment controller here. This device has an automatic screen adjustment, so there is no focus button. In the image on the left, the focus is well positioned, so you can see the thyroid gland well. However, in the image on the right, the focus is superficial, and the inside of the thyroid gland does not look homogeneous. If the area you want to see is near the skin outside the thyroid gland, you can test it by positioning the focus like in the image on the right, and then when you look at the thyroid gland, you can test it by lowering the focus and adjusting it. This patient has a fairly thick neck. When you compare the image on the left and right, there are two big differences. First, the degree of pressure is different. In the image on the right, you can see that the thickness of the SCM muscle is thinner than on the left. So you guess that the right image was taken with more pressure on it. Second, the location of the focus is different. There is a nodule near the back of the thyroid gland. If you place the focus in the area where the lesion is as shown in the image on the right, it is more clearly seen. I hope this will help you. Thank you.